So this video demonstrates a post-burn contractural axilla release. So as you can see, this is a type 1 axillary contracture with intact cupola and the hair bearing area, and we have a significant contracture band. Now for this, typically I would have planned a bipedical flap release, but in this case, since the hair growing area is intern a bit, as you will see intraoperatively, we didn't plan for that particular flap, and this particular markings have been made. Now since the height of the contracture band, as you can appreciate, is significantly higher, a Z-plasty again wouldn't have been a better option, typically because Z-plasty distorts the hair bearing area, and also when the height of the contracture band is as significant as in this case, what happens is that the Zs become, the tips of the Zs become a bit risky, they tend to become a bit dusky, and then what happens is some of the area heals by secondary intention, and then there is obviously some amount of recontracture. So we want to avoid that, and that is why this particular plan has been executed. Now the surgical steps are fairly straightforward. We go and incise the contracture band. Here you can see the fibrous tissue being incised and the band is being gradually released. Now as we all know, type 1 contractures typically involve only the anterior axillary fold. In type 2, the severity increases, both the folds are involved, and in type 3 then there is involvement of the hair bearing area as well. Now as I had mentioned previously, you can see that the hair bearing area appears to be enrolled a bit. So you can see that there is a pocket, sort of a pocket, which is formed there, because of which a bipedical flap would not have been an appropriate choice. So we try to release it as much as possible so that the hair bearing area try to cover its normal anatomical course. The rest of the area obviously needs to be grafted. What is important in all burn contractures is the band release should be optimal. Now when it comes to fishtailing, the length of the fishtails should approximately be 1/3 of our incision line, or probably even more. Now after the release, you shouldn't be finding a straight line. In this case too, I feel it would have been better if the fishtails could have been a bit longer. But yes, there is still some amount of denting over that suture line. Hair bearing area is now being sutured to its original position, as you can see over here. Now the anterior axillary fold and the raw area over the arm is to be grafted. We have achieved an abduction of around 120 degrees, or probably even more, which we will maintain with the help of an aeroplane splint. This graft will be anchored, will be fixed with tie-over dressing, and once the tie-over dressings are done, we will give an aeroplane slab, aeroplane splint, and regular dressings are to be done. So that was all.